Let me review few important information for NCLEX board. It is rapid review. First of all, vital sign, they said heart rate 80 to 100 beat per minute, the normal. And respiratory rate 12 to 20 beat per minute. Blood pressure systolic 110 to 120 millimeter of mercury. Diastolic 60 millimeter of mercury. It is average. And temperature normally 37 degrees Celsius. If you convert it to Fahrenheit, it would be 98.6 degree Fahrenheit. Let me talk about little bit hematological values. Red blood cell 4.5 to 5.0 million. Whereas the white blood cell 5,000 to 10,000. Platelet is 200,000 to 400,000. So if red blood cell is reduced, patient developed anemia. If white blood cell is altered, means increased, patient indicate infection. Platelet when less, patient develop bleeding. Hemoglobin normally 12 to 16 in case of female, but men it is more 14 to 18 gram. Hemoglobin is less in female because of blood loss, menstruation. Hematocrit 37 to 47 female, 40 to 54 men. So if hemoglobin go down, hematocrit also go down. Serum electrolyte, sodium level 135, 145 milliequivalent per liter. Potassium level 3.52, 5.5, whereas the magnesium 1.52, 0.5, and phosphorus 0.5, 4.5. So if potassium level is altered, patient develop arrhythmia, which is lead to cardiac arrest. If sodium imbalance, it lead to potassium imbalance, and potassium imbalance lead to cardiac arrest. Next here, blood gas analysis. pH normally 7.35 to 7.45. If it is less than 7.35, we call acidic. If it is more than 7.45, we call basic or alkaline. Bicarbonate ion 24 to 26 milliequivalent per liter. Bicarbonate ion is a marker of metabolic, either metabolic alkalosis or metabolic acidosis, but bicarbonate is a marker. It would be metabolic or respiratory. Whereas the carbon dioxide 35 to 45 milliequivalent per liter. And partial pressure of oxygen usually 80 to 100%. Saturation of oxygen more than 95%. So bicarbonate ion is an indicator of respiratory problem, either respiratory alkalosis or acidosis. In case of acid-base balance, we can remember ROME, ROME. R stands for respiratory, O for opposite, M stands for metabolic, E for equivalent. What does it mean? It is the easy way to remember. That is respiratory acidosis or alkalosis disorder. pH is opposite to the other component. But whereas the metabolic, it should be equal with the pH, with in disorder pH in relation to the other component. Next here, other blood chemistry, you can see. So blood glucose normally 70 to 110 milliequivalent per dl. Urine specific gravity 1.013, 1.030 specific gravity. So in diabetes insipidus, where is the too much urine produced, urine specific gravity go down. And BUN, blood urine nitrogen, 7 to 282 milliequivalent per dl. So it is the kidney marker test. Serum creatinine, also kidney function marker, it should be less than 1 or 1.6 to 1.35. LDH, lactate dehydrogenase. It is the enzyme or marker for indicate the heart problem. Normally it is 100 to 190 unit per liter. The protein 6.2 to 8.1 gram per dl. Albumin 3.4 to 5.0 gram per dl. So albumin is the one type of protein. Protein is a chain of amino acid, and albumin is the smallest molecule of protein. So if anybody has a proteinuria, means protein present in urine, maybe the problem in the kidney, right? When oncotic pressure is reduced, patient develop ascites. Oncotic pressure means if protein imbalance, oncotic pressure also imbalance. Bilirubin level should be less than 1.0. Right? If it is more, patient develop jaundice. Total cholesterol 130 to 200, and triglyceride 400 to 50 milligram per dl, and uric acid level 3.5 to 7.5 milligram per dl. And CPK means C-reactive protein, or CPK 21 to 232. You see, what are the big range? And next go here, therapeutic drugs level. So carbamazepine normally 4 to 10. So carbamazepine, if less than 4, it does not work. If carbamazepine more than 10 concentration, it would be poisonous. Like digoxin, other name is called lamoxin, 0.8 to 2.0. So digoxin is a drug we use for cardiac failure or heart patient. Gentamicin, antibiotics, therapeutic drugs level 5 to 10. So if you give gentamicin less than 5, it does not work. If it is gentamicin concentration more than 10, it would be poison for the tissue or body. Lithium is a mood stabilizer, 0.8 to 1.5 milliequivalent per liter. Phenobarbital, 15 to 40 microgram per dl. Phenytoin, this is actually drugs for seizure. Other name is called Dilantin, 10 to 20 microgram per dl. And theophylline or aminophylline we use as a bronchodilator, 10 to 20. So it is easy to remember. Phenytoin and theophylline therapeutic index drug level is same. And tobramycin 5 to 10. Valproic acid, it is also anti-seizure, 50 to 100. It is long range. And vancomycin 20 to 40 microgram per ml. Here was few talks about the anticoagulant therapy. So warfarin, other name is called coumadin, is an anticoagulant. Heparin also anticoagulant, but heparin we use for injectable form, but warfarin we can use orally. Heparin instantly work, but warfarin take time to work. So when patient is under emergency in hospital, we give heparin. But when patient transferred to the home, we give them to start warfarin. So when your patient need warfarin, it is good to check prothrombin time, and it would be 10 to 20 seconds. If warfarin it causes any toxicity, antidote vitamin K. INR, international normalized ratio, should be 0.9 to 1.2. And heparin, in case of heparin, we should check PTT, and it would be 30 to 45 seconds. Or also activated partial thrombin time should be 23rd to 31.9 seconds. And also fibrinogen level, 103 to 377 microgram per dl. And here we can see a few conversion. Sometimes NCLEX board give some mathematical problem. So conversion is a first steps. So 1 small teaspoon equal to 5 ml, but tablespoon equal to 3 small teaspoon, or 1 big spoon or tablespoon equal to 15 ml. 1 ounce equal to 30 ml, right? Sometimes we say my patient take 1 ounce orange juice, means 30 ml orange juice. 1 cup equal to 8 ounce, right? Next, go. Here say 1 gram equal to 1000 microgram. 1 kilogram equal to 2.2 pounds. So in board exam, if you get any mathematical problem, patient body weight is pound, we need to convert to kilogram, right? 1 pound equal to 16 ounce. Next, go maternity normal values. Normal fetal heart rate should be 120 to 160 beats per minute. So if fetal heart rate less than 120, we call deceleration. If it is more than 160, it is called acceleration. Both are bad. And variability is 6 to 10 beats per minute. Amniotic fluid supposed to be 500 to 1200 ml. And contraction of the baby, it should be 2 to 5 minutes apart, with duration less than 90 seconds and intensity of less than 100 millimeter of mercury. APGAR score is important to measure your baby. So APGAR means we should check baby's appearance. Is it blue or pink? Pulse rate, grimaces, activities, muscle activities, reflexes, reflex irritabilities. So done at 1 to 5 minutes with a score 0 for absence, 1 for decreased, 2 for strongly positive, and score 7 and above are generally normal. 4 to 6 is firmly low, and 3 or below are generally regarded as critically low. So stop the treatment for maternal hypotension after the epidural anesthesia. We should stop the infusion of ketone, right? in case of hypotension after epidural anesthesia. Also turn the client on her left side, admin oxygen, and if hypovolemia is present, give IV saline or IV fluid. Here we go and talk the pregnancy categories of drugs. So we categorize the three level: category 1, category B or E. A category means no risks in controlled human studies. Category B drugs, no risks in other studies. Example, amoxicillin, cefotaxime, they are in category B. Whereas the category C drugs, risks not rule out. Example, rifampin is a TB medication or theophylline for bronchial asthma, category C. And category D, positive evidence of the risks, example, phenytoin. So if mother is pregnant, it is good not to give, right? Also, tetracycline, they have a teratogenic effect over the body, children. Category X, it is contraindicated in pregnancy. Example, isotretinoin. It is a medication we use for acne, right? Also, thalidomide. Pregnancy category N, not yet classified. So here showing the some drugs schedule. Schedule 1, 2, 3, 4, and 5. So they said schedule 1 means no currently acceptable medical use or for research use only. Example is heroin. So it is not allowed to use. Category 2 or schedule 2 drugs with the high potential for abuse and require written prescription, right? Like meperidine, hydromorphine, and schedule 3 require the new prescription after 6 months or 5 refill. Example, codeine, testosterone, and ketamine. And schedule 4 require the new prescriptions after the 6 months, like soma, telium. And schedule 5 dispensed as many other prescription or without prescription, like cough suppression or lamotril or photofen. Now, medication classification. Antacid, usually we use to reduce hydrochloric acid in the stomach. We can buy over the counter. Antiemetics means medication we use to stop the, so it is anti-anemics, right? Increase the blood cell, so increase the blood cell production. Next, here we go. Anticholinergics decrease the oral secretion. Anticoagulant prevent the clot formation. Anticonvulsant we use for management of seizure and or bipolar disorder. Antidiarrheal decrease the gastric motility and reduce water loss in bowel. Antihistamine block the release of histamine. Antihypertensive lower the blood pressure and increase the blood flow. Anti-infective used for treatment of infection. Bronchodilators dilate the large air passages in asthma or lung disease. in case of COPD. Diuretics decrease the water and sodium from the loop of handling. So diuretics we use for as an antihypertensive or if patient has an edema. Laxatives promote the passage of stool. Myotics constrict the pupil, and mydriatics dilate the pupils. Easy to remember, mydriatics is means spelling is D, and dilatation also D. Narcotics or analgesics relieve moderate to severe pain. Now we are talking the role of 9 for calculating total body surface area in case of burn patient. So according to the rule of 9, we said head areas is 9% and arms, the left and right, each is 9%, total 18, and back side 18%, legs, left and right 18 and 18, total 36%, and genitalia is 1%. More medication, digoxin or lemoxin. If you give your patient, it is good assessment of pulses for a full minute. If less than 60 beat, it is good to hold the digoxin. And also check the digitals and all potassium levels. Aluminum hydroxide we use to treat GERD, means gastroesophageal reflux disease, and also kidney stone. Hydroxyzine treat of the anxiety and itching. Midazolam given for conscious sedation or respiratory depression and hypotension. Amiodarone. Amiodarone, when we give, it is important to measure diaphoresis, dyspnea, and lethargy, and take the missed dose anytime in the day or to skip it entirely. So never give the missing dose with the next dose, not a double dose together. Do not take double, right? In case of warfarin, other name is coumadin, for the, we have to check for the sign of bleeding, diarrhea, fever, rash, also stress importance to complying with prescribed doses and follow-up appointment. Methylphenidate is a treatment for ADHD, also assessed for the heart-related side effect and reported immediately. The child may need a drug holiday because the drugs stunt the growth. So dopamine we use to treatment of hypotension, treatment for shock or low cardiac output. When my patient take dopamine, it is important to monitor EKG for arrhythmias and blood pressure. Rifampin causes the red-orange tear in urine. Rifampin we use for anti-TB medication. Ethambutol causes problem with vision or liver problem. So it is good to check liver function, or it causes color discrimination. Isoniazid also, TB drugs can cause peripheral neuropathy. You educate your patient to take vitamin B12 to counter, means to prevent peripheral neuropathy. So let me talk about the developmental milestone. So when baby 2 to 3 months, they're able to turn head up and also can turn side to side, making cooling or uh, gargling noise, or can turn head to sound. When children 4 to 5 months, they can grasp or switch, also roll over tummy to back. They can know how to make a bubble and also can mimic the sound. 6 to 7 months, the baby can sit at 6 and also wave and say bye-bye, or can recognize the familiar faces, and also knows if someone is a stranger, or paces things back and forth between the hands. When they are 8 to 9 months, stand straight at 8. Also, they have a favorite toy. They place peekaboo. 10 to 11 months, the baby belly to butt, or 12 to 1 years, or 12 to 13 months or 1 year, they can speak up, or they can uh, say the 12 or upwards. They drinks from a cup. Baby cries when parents leave. Also uses um, furniture to cruise. So in case of cultural consideration, we can see in African Americans may believe that illness is caused by supernatural causes, and always look for advice and remedies from faith and healer. They are family oriented and have higher incidence of high blood pressure and obesity. So high blood pressure, hypertension, or cardiac disease and obesity incidence rate is more in African American. Also high incidence of lactose intolerance with difficulty digestion milk and milk product. In case of Arab Americans, they may remain silent about the health problem such as sexual transmitted infections or substance abuse or mental illness. Also, they devout Muslims may interpret illness as the will of Allah, a test of faith, or may relay the right tools of cure or alternative therapies before looking for help from healthcare provider. Or after death, the family uh, may went to prepare the body by washing or wrapping the body with a white cloth. Or post-mortem examination are discouraged unless required by the law, or may avoid the pork or alcohol if Muslims. Islamic patient observe the month-long fast of Ramadan. Also, people suffering from the chronic illness, pregnant women, breastfeeding, um, breastfeeding, or during the menstruation, do not fast. Female avoid the eye contact with men and also use the same-sex family member as an interpreter. In case of Asian American, may values ability to endure the pain and grieve with silence. Also, stoicism or typically family-oriented. Extended family should be involved in care of dying patients or believes in hot and cold. If they said in young, often involved. Sodium intake is generally high because of salted and dry foods, or may believe prolonged eye contact is rude and an invasion of privacy. May not without necessarily understand or may prefer to maintain a comfortable physical distance between patients and healthcare provider. In case of Latino American, may view illness as a sign of weakness or punishment of evil doing. May consult with a curandero or odo priest. Family members are typically involved in all aspects of decision making, such as terminal illness, may see no reason to submit to mammogram or vaccinations. Native American may turn to a medicine man to determine the true cause of an illness, or may values the ability to endure pain or grief with the silent stoicism, or diet may be deficient in vitamin D or calcium because many suffer from lactose intolerance or do not drink milk. Obesity and diabetics are a major health concern, may divert eye to the floor when they are paying attention. In case of Western culture, may value technology almost exclusively to the struggle to conquer the diseases. Health is understood to be the absence or minimization or control of disease process. Eating utensils usually consist of knife, fork, or spoon, or 3 daily meals is typical.